Expectations. In some ways, this is the most difficult subject to talk about with parents because it involves facing a really unpleasant reality. Right now, despite all of our knowledge, despite all of the research being done into mental illness, despite all of the advances we've made in understanding the nature of mood disorders, bipolar disorder, and its newly identified phenotype dubbed fear of harm, and despite all of the effective treatment options that have been developed, the truth is that as of 2023, we don't yet have a cure for these mental illnesses. Once these illnesses emerge, there's no stuffing that rabbit back in the hat. There's no magic wand that will make it so that your child no longer has a mood disorder, bipolar disorder, or FOH. These disorders will persist for a lifetime. But while all of that is true, what we do have is ways to manage them. And through accurate and effective treatment, these illnesses and their symptoms won't stay static. Their intensity will change, and long term outcomes can be significantly and positively altered and impacted by the use of good treatments and tools for managing symptom outbreaks. You see, the degree to which symptoms are present will ebb and flow over time due to how prevalent external stressors, seasonal fluctuations, physical growth, physical health, injury, or countless other factors are. All of these items have an effect on mental health and mood stability. Over the course of a lifetime, medication and treatment will continue to be about helping deal with symptoms, reducing some, putting some into remission, and learning how best to manage others. The expectation that finding the right medication and treatment will mean that everything is magically repaired is an unrealistic one. But this is not to say that there's no hope. Don't despair. On the contrary, the right combination of medication, treatment, and lifestyle interventions can give children, teens, and adults with mental illness something they may have never had before: a level playing field. So let's get some questions we know you have out of the way first. You want to know, will stability be achieved immediately? No. It takes time for medications to take effect, and it takes time to become ready to engage in the behavioral treatments. Will things improve over time? Yes. And things that were impossibly difficult before treatment will be meaningfully improved during and after treatment. Will treatment fix your child? No, your child doesn't need to be fixed. They're not broken. They have a mental health challenge that is, in fact, manageable. And managing one's mental health is an ongoing process of self care and self exploration that never ends for anyone. Will your child have fewer obstacles to living life successfully and to the fullest? Yes. The reduction in symptoms will make life easier with fewer conflicts and less stress. Will your child begin treatment and suddenly be all caught up with their peers, developmentally, socially, and emotionally? No. They've lost a lot of ground, and there's a lot of work that needs to be done to bridge that gap. Will your child become more capable and available to learn the same things that other children learn? Yes. Once stability is achieved, they will finally be on solid ground. And the longer there is stability, the longer they're likely to maintain stability, and the more confidence will be built. Our expectations of treatment must be grounded in this reality. Treatment doesn't fix anything. It gives us the tools to find balance and to improve the quality of our and our children's lives. The degree of improvement we experience is based in part on our consistency in using those tools, but it also depends on things over which we have no control. like our biology, our genes, and how well our brain and body chemistry respond to medications. It's within this delicate balance that we each do our part. Once you find an effective treatment plan, medications may be stopped, added, or changed in dose or frequency. The resulting biochemical changes in the brain and body often cause temporary disruptions in the quest for stability that can make you feel as though you're sliding backwards towards a more chaotic time, rather than moving forward towards balance and stability. And while you are still moving forward, during these times of transition, things may feel harder rather than easier. But as the correct medications take effect, you will begin to see signs of improvement. Because we're so eager for improvement, we're inclined to look for enormous or super fast changes to reassure ourselves that we're on the right path. But meaningful change takes time, and there's no miracle cure to be found. But most often, medications take weeks or months rather than days to take effect or to build to a therapeutic dose. The placebo effect can cause us to imagine a new medication is the miracle we've been seeking when there are coincidental improvements in the first couple of days. We may also discover that new medications take so long to start to take effect that we don't realize that there are tiny incremental changes happening right under our noses, and we assume that nothing at all is happening. In the beginning, try to keep your attention out for small but noteworthy improvements. In fact, you might not realize it at first that you are in fact seeing evidence of improvement. Sometimes it might take hours or even days to notice signs because you were too close to the page to see them in the moment. For example, you might notice new things, such as some outbursts are a little shorter in duration than they used to be, or that your child comes out of the tantrum more smoothly. You might find that your child is able to sit at the dinner table for 5 minutes instead of not coming to the table at all. There might be a time when your child completes a task the second time she's asked, rather than needing to be told 10 or 15 times. Or he may, without being asked, offer an apology for something he did or said. You may also find that there are things that you're expecting that don't happen, such as an argument that doesn't happen, or there's a time when your child doesn't talk back the way you were expecting. It could be that your child stomps off to her room and slams the bedroom door instead of hitting her mother. Or you may simply find that you're bracing yourself for a storm that never comes. These signs of improvement grow over time as stability increases and the work of treatment continues, until one day you might just forget to brace yourself in the first place and you realize that you're no longer walking on eggshells. Some patients and parents enter the treatment process already understanding that there's no magical treatment that will wipe away the illness, and they're prepared for the work. Some begin with unrealistic expectations, but disappointment is mitigated by the reduction in symptoms and the relief that that brings. Some remain frustrated that their child will never have the illness go away, and they continue to stumble through looking for a cure. Overall, most parents go through some combination of these expectations, which is normal and natural. But those who focus on improving quality of life and developing management skills rather than finding cures tend to find some peace, balance, and stability more easily. But however parents come to the treatment process, every one of us must work to overcome the most basic of missed expectations, our hopes and dreams for our children. When babies are born without any visible disability, they start their lives with parents who think of them as being perfect. Of course, no one is perfect, not even an infant, But our hopes and dreams for our children are larger than life, and we imagine them able to climb any mountain, achieve any goal, and live a better life than we have so far. Reality makes relatively short work of this delusion as our newborns scream and cry to be fed, changed, and entertained, as they grow to become toddlers who have tantrums and make irrational demands, and as they grow to become children who have individual personalities we weren't expecting or disabilities that no one could see before. All parents struggle with this reality as children grow up to become rebellious adolescents who finally grow to become independent adults. This is the progression we understand intellectually and come to accept emotionally as an expected developmental process. But parents of kids with mood disorders, bipolar, and FOH often have a different struggle. Often with early onset mental illness, parents worry about more than just whether or not their children will have good friends or make good grades in school. We worry about whether or not our children are going to be able to have any friends at all, stay in school, or get and keep a job. We worry whether our children will wind up getting hurt in fights, will get arrested, or shot by the police. We don't worry so much about what they'll be when they grow up. We worry about whether or not they'll be able to grow up. We spend so many years trying to help them navigate the world that we wonder if they'll ever be able to do it independently. And the contrast is stark between what we imagined for our child when they were a perfect baby and what we finally realize will be all the obstacles they have to manage. And we face a grief that is as intense and painful as that of parents who've had a child die. A recent study out of the University of Maine addressed the grief of parents of children with serious mental illness, which highlights the pervasive strains and stigma associated with loving and caring for a child who suffers from serious mental illness. For these parents in particular, there are mothers and fathers in mourning who've expressed grief and loss similar to that of parents whose children have died, though parents of children with serious mental illness lack the closure and community support that often comes with the loss of a child. The combination of mental illness, emotional isolation, unrealistic societal expectations, and grief can be overwhelming for families. This intersection creates additional pain and suffering that damages family life and the quality of life for children and their parents. But when we are able to accept that there is a grieving process that goes along with the loss of what we expected, what we hoped and dreamed for our babies, and when we find community to help us break down the isolation and with whom to share the grief, we are able to let go and repair. When we can let go of the things that we want or wanted for our children, we discover something beautiful happens. We become able to see, accept, and embrace the beauty of their journey, of the path that our child is on. It may not be familiar to us, but it's there and it's theirs. And once we let go of our expectations and grief, we realize what an honor it is to walk that path with them and to share the joys and sorrows that will be on it. It is not easy, but with the support of your community, you will be able to more clearly see your child's challenges for what they are, no more and no less. You'll see their path to recovery and their improvement, both incremental and triumphant along the way.